Hello everyone, thank you for joining me. Today I'm going to present my project that concerns on the COVID pandemic impact on rehab services for post-stroke patients. This project is affiliated with multiple researchers and is affiliated with different universities, research centers, and scholarship organizations. In today's discussion, I'm going to talk about the following topics. Let's start with background. As we all know that stroke rehabilitation always follows a standardized protocol that promotes high quality care for functional recovery. But since COVID pandemic, these services are adversely impacted. In addition, in a newsletter that was released by WHO in June 2020, it was stated that rehab services were the most commonly disrupted healthcare services, mostly because they were deemed non-essential. Normally, rehab services requires frequent and prolonged interaction, which was affected or challenged because of the COVID restrictions. In addition, close interactions were not possible because of the risk of getting infected. In addition, stroke patients with cognitive disorders having communication skills impairments, on top of it, the therapist and the patients had to wear masks, which further led to difficulty in understanding the verbal and non-verbal cues, which affected the communication between the patient and therapist. Also, the involvement of family and caregivers in planning the delivery of care for patients is very crucial, but this was limited due to the COVID-19 restrictions. Moreover, patients with post-stroke were further contracted with COVID infection that led to exacerbation of their post-stroke motor deficits, which led to decreased muscle strength and exercise capacity. Also, the multidisciplinary rehab staff were not particularly working in their area of expertise, and there was greater demand, which led to increase in workload. And the rehab staff were working in both hot and cold zones, that is the COVID positive and non-COVID zones in the rehab centers. The COVID pandemic was also hit in Quebec, and it was reported state health emergency on March 13th, 2020, and multiple regulatory agencies such as M3S had recommended few regulations for preventing transmission of infection, and also they created COVID designated rehab centers throughout the province of Quebec. And of course, there were challenges while providing these services in these rehab centers, such as physical distancing and compulsory wearing of personal protective equipments and limited staff availability, which further led to increased risk of infection transmission. There are total 14 COVID centers in the province of Quebec, but the following 10 are included in our study. This is a representation of how post-stroke patients were allocated in the COVID designated rehab centers according to their COVID status. The post-stroke patients with COVID infections were admitted in the hot zones, that is the COVID units, and COVID negative patients were admitted in the cold zones. Irrespective of their admission, all of the post-stroke patients had to undergo COVID regulations such as frequent COVID testing, PPE kits, sanitization, social distancing, and wearing masks along with other regulations. Till today, we have 6 COVID waves in Quebec, and the first 3 waves, as seen in the figure, showed maximum confirmed COVID cases, and there were maximum intensive care admissions as well. This time frame, that is between March 2020 and May 2021, has been reported as crucial since there were limited provision of vaccination. Hence, more severe cases were reported, which required more intensive care admission. Hence, this time frame is selected as our patient recruitment period. Next, we'll discuss about objective and hypothesis. So, our objective is to determine the impact of COVID pandemic on rehab potential and care in stroke individuals that were admitted in these designated centers in the province of Quebec. And we hypothesize that in comparison to the pre-COVID group, that is the users admitted a year before the pandemic, the rehab potential and care trajectory will be negatively affected in COVID positives due to the deterioration of their health condition, and in both COVID positive and negative group due to the operational changes in the provision of rehab services and underlying health condition. Next, we'll discuss on the study design. We are performing a retrospective cross-sectional study of the medical records, and data collection is ongoing in the listed rehab centers. We have recruited patients at age 18 years and above. The COVID positive patients were identified according to the basis of their PCR test results during or before their admission to the rehab centers. And the COVID positive and negative groups are being selected according to their admission between March 2020 and May 2021, and pre-COVID groups between March 2019 and Feb 2020. The study process includes patients that are diagnosed with COVID positive stroke post-stroke according to the health experts and hospital archive experts, and we are also recruiting equal number of COVID negative and pre-COVID patients. Further, we have included variables according to the discussions with our clinical partners, and the variables are categorized into the following categories. The example of few are socio-demographic and descriptive variables includes age, sex, number of comorbidities, prior medical care, including emergency, intensive, acute care, descriptive markers such as contractures, relapses, pressure sores, and multidisciplinary team involving physiotherapy, occupation therapy, orthopedics, and so on. Primary outcome variable specifically for stroke patients is functional independence measure, and that is for specifically for stroke measure, and other impairments we have recruited different variables according to the measurements. Preliminary analysis of 64 patients from Willamette and Jewish Hospital shows that they are their average age is 75 years and male to female sex ratio of 29:35. The comparison among the three groups shows that more patients with COVID positive, that is a red one, had required intensive admission and intubation compared to the COVID negative blue ones and pre-COVID the green ones. Also, the COVID positive patients had longer stay in acute care. There was a trend for COVID positive to be more impaired on admission, but they were significantly more disabled at discharge according to the FIM scores. Despite the fact that they had longer stay in rehab care and received more PTOT session compared to the COVID negative group. Also, the COVID positive showed resembled rehab profile as the pre-COVID group. According to the hypothesis, this result shows that COVID positive patients were more affected and they required more medical care before being admitted to the rehab centers. On the contrary, COVID negative patients were less affected and they showed better outcome despite spending less time in the rehab centers. And the COVID positive patients had functional profile that resembled with the pre-COVID patients, suggesting that longer stay in rehab could have minimized the impact of COVID infection on their rehab potential. Further, we are planning to recruit 100 stroke patients in these groups, and we'll include more variables in our analysis. We'll further perform multiple linear regression model to estimate the influence of these predictor variables. And we'll publish our results in scientific journals and present our results in conferences such as Canadian Physiotherapy Association and American Neurorehabilitation Meeting. Next phase of our project involves performing survey of the patients and healthcare professionals on their experience of care and unmet needs during the rehabilitation. Finally, the project will allow us to have information on how the COVID pandemic has influenced the rehabilitation care of these patients and the factors that most influence their rehabilitation potential and recovery gains. Further, our study also aligns with the Rehab 2030, a call for action initiative by WHO, by understanding the growing unmet needs of rehab care during the pre-pandemic, early pandemic scenario. Ultimately, our study will help to contribute the elaboration of recommendations to develop efficient and standardized rehab potential and protocol in the advent of future pandemics. I would like to thank the clinicians, coordinators, and research assistants for participating in the project, and funding agencies, Career and Repair, for providing this scholarship. Thank you.
Are there any questions? You can write them out in the chat and I will read them out. If there aren't any questions, I would encourage you to go back into the webinar using the button that you used to access it this morning to access Zoom. So that's it. Is there any, or you guys can directly say your questions as well.
Palak?
Yeah.
Can you hear me? This is
Yes.
Marie-Hélène. Well done. It was a very good presentation. I guess it's worth mentioning also that we're also recruiting, we're also including participants that were in the other programs, right? So not only
Yes.
we're looking at post-stroke individuals, but we're also gonna do the same analysis for people in
Traumatology.
yeah, and
scientific.
physique. Yeah.
Yes.
And in total, we should have about 600 patients, COVID plus, overall in all categories of patients. So I think it's 400. So it will be a study including in total 1,200 participants in the 3 groups.
Yeah.